Hi, my name is Megan Trainer, and I'm the athletic trainer for Rehab to Perform, and I'm contracted out to St. John's Catholic Prep as their athletic trainer for all their sports. All right, we're gonna talk about post-injury acute care. When you get an injury, say out at football practice, out at soccer practice, what you have to do to take care of it that moment and for the rest of that night in the next few days. Okay, so that's an acute injury. So with that, a lot of people have heard of the acronym that's very important to know, which is RICE. So rest, ice, compression, elevation, okay? Some people will even add a P on the front for protection, so make it price, but that's not as much of an important, that's more for like a fracture or bigger injury. For basic injuries, what we're gonna talk about today is rest, ice, compression, elevation. Say you tweaked your knee at football today when you're on the line. No matter what I say, maybe the injury, whatever's going on, you always wanna stick to RICE, okay? So you rest it, obviously for the rest of that practice. You're gonna rest that evening. You're not gonna go walk the mall. You wanna rest it. Give it that time to relax and kind of calm down. Ice is always the big one that everybody knows about. Ice is good for pain. And a lot of people wanna jump in and put heat on there. Never put heat if it's swelling. So the first couple of days, stay away from heat. If you have fluid going to that area for swelling, heat's gonna make it feel good, but it's just gonna increase that swelling, which the more swelling you get in there, the bigger the problem is later to try to get that swelling out of there. So the C is compression. So lots of times I'll throw an ACE wrap on there, or if you have like a knee sleeve or an ankle sleeve, something to give it a little bit of compression, again, to help push that swelling up out of there to keep it from kind of solidifying in that joint, okay? And then elevation is the biggest one of RICE. A lot of people think ice is. Elevation is the biggest one, because if you just say have an ankle injury or a knee injury and you ice it down in this position where you're sitting, you think about gravity's pulling fluid down. So if you have an ankle injury, it doesn't matter how much you ice it, it's still gonna puff up because that's where the fluid can't get out of there. So you need to have it elevated at least to like straight out in front of you. If not, the best thing is above the level of your heart is what they say. So elevation is the key for the next few days. We already talked about no heat. You can also do what's called NSAIDs, non-steroidal anti-inflammatory drugs. So a lot of people know these. Over-the-counter drugs is Advil, ibuprofen, Aleve, anything basically except for acetaminophen or Tylenol. So Tylenol is just for pain. All the other ones have non-steroidals in it that will help with that inflammation to aid with the elevation, the ice, everything you're doing to get that inflammation out of that joint. So all of that is important, kind of a combination. And lots of times I will tell your son or daughter to do it for probably the rest of that week, 3 times a day, okay? So if you just do it once or twice, it's only for pain. If you do it 3 times a day, it builds up a constant level in your system that works on that inflammation constantly throughout the day to get that inflammation out of there. Once or twice just isn't gonna do it. The only other thing I wanna talk about for post-acute care, if we think that it's not anything major, we just need to kind of give it a couple days to rest. If you're still having significant pain 3 days later, 3 or 4 days later, still having significant swelling, or any kind of blood flow restriction, like if your foot falls asleep, if it's your ankle or your knee, or your foot starts turning blue, something like that, where the blood flow is being restricted or the nerve is being restricted, then you need to go get it checked out. But otherwise, stay the course of the treatment and we'll get you through it. If you have any further questions, feel free to comment below and we will get back to you as soon as we can. Or if not, we will shoot another video and add it in here.